Hello and welcome back to Off Grid Style. I'm Nikki and I'm glad as always to have you here. Today we're discussing wilderness wound care. What happens if you're out in the wilderness and something happens to someone, God forbid, whether it's an everyday wilderness survival situation or it is an SHTF situation where you can't get to help. What do you do? So let's find out. Let's get started.
In the wilderness, injuries and wounds can happen unexpectedly. Wilderness wound care is a critical skill for outdoor enthusiasts, hikers, and survivalists. Today, we're going to look at the fundamental principles of wilderness wound care, including cleaning the wound, dressing it, managing wound care, recognizing signs of infection, and preventing infections. Of course, this video is for information and educational purposes only. Before you attempt to apply these skills, it's a good idea to take a first responders course. First, let's take a look at cleaning the wound. Clean water. The first step in wilderness wound care is to clean the wound with clean, purified water. If soap is available, use soap with the water. And if you aren't sure about the cleanliness of the water you need to use, then use a water purification method to ensure that it is clean. The wound can also be cleaned with iodine or hydrogen peroxide. If you find some nearby, you can use the aloe vera plant as a natural disinfectant for wounds. The gel inside the leaves has natural antimicrobial properties. If the victim requires sutures, you need to get to the nearest ER within 12 hours. If the victim requires a tetanus shot, you have 48 hours in which to get one. Remember, tetanus shots are only good for 5 years when it comes to wounds. Irrigation. Use a syringe or a clean cloth to gently irrigate the wound, removing dirt, debris, and bacteria. Don't scrub at the wound because it can worsen the injury. Let's look at dressing the wound. Whenever possible, use sterile 2x2s, 4x4s, or Band-Aids from a first aid kit. If unavailable, you can improvise with clean, non-fluffy materials like clothing or bandanas. You will then need to apply a suitable antiseptic solution, like triple antibiotic ointment, to the wound to further reduce the risk of infection. If traditional antibiotic creams aren't available, you can apply raw honey, aloe vera, crushed fresh garlic, turmeric, or crushed calendula flowers that you have turned into a paste with water. All of these have antibiotic properties. Proper bandaging. Apply a sterile dressing and wrap to cover the wound. Ensure it is snug but not too tight, as proper circulation is crucial for healing. You should be able to place 2 fingers underneath the Kerlix or Ace wrap. You'll want to change the wound dressings every 24 hours to prevent infection and to check for any signs of complications. Be sure to keep the dressing clean and dry. If the dressing becomes wet or dirty, you need to change it. Now, let's talk about signs of infection. If the wound becomes increasingly red, swollen, or warm, it may be a sign of infection. Also, any discharge from the wound that is yellow or greenish could indicate infection. A fever is a systemic sign that the body is fighting an infection. If the person's temperature is above 99.6, you need to seek medical attention. Prevention of infection. Always wash your hands before tending to a wound to prevent introducing new bacteria. Keep wounds covered with clean, dry dressings to protect them from dirt and potential contamination. Whenever possible, avoid soaking a wound in natural bodies of water, as they may contain bacteria. Maintaining a healthy diet can boost the body's immune system, aiding in the prevention and healing of infections.
I hope you liked the video. I thank you very much for joining me for it. I hope you learned something. And this is part of a wilderness survival series that we do. The reason we do this is because every single day I post a question at about 6 a.m. in the morning, my time, that asks you a question for the day. And it seemed like the wilderness questions were the ones that were being missed the most. And that's what prompted me to start this series. So I hope you liked it. Let me know what you thought. Let me know your ideas. Please like, comment, subscribe, all the good stuff. And thank you very much.